Hello, my name is Zanny Amaral, Clinical Specialist for Air Liquide Healthcare Vital Air. Today, we'll be talking about the monnal t60 ventilator in-servicing. In addition to the manual that is available to you, we have some useful documents such as the important documents, troubleshooting guide, as well as the in-service guidelines that we follow. The next section that we'll be talking to you about is the accessories that are available to you with the monnal t60. In order to benefit from the transport certifications aerial and ground, the device must be inside the transport bag. You can also have the option of having the snap hooks to attach it onto the ambulance. Next, available to you is the roll stand. On the back of the roll stand, you do have a place to secure an O2 tank. You also have the option of a basket. On the side, you will notice a plug to block your circuit during the auto test. You will notice that you also have place for an extendable arm as well as an IV pole. On the bottom of the roll stand, there is a support bracket for your humidifier. To unclip the device from the roll stand, you have to lift the handle towards you and unclip it like so. To clip the device back onto the roll stand, you will have to line the hole with the black clips. To secure it, you must clip it downwards. Once you hear the click, that means it's secured. You may have noticed the hooks on the back of the device, which is called the universal hooks. These hooks are only for internal transport. It is to be placed on the patient bed for any internal transport that you may have. The monnal t60 is a transport device that weighs 4 kilos. It can be used for patients from 3 kilos and above. It is separated into two sections. You have your pneumatic system and your patient system here. We will start with the pneumatic system. You have the most important button on the device, how to turn it on. Next is your AC power cable to charge your device. It is recommended to always keep it plugged into the AC outlet. Next, you do have your HEPA filter that needs to be changed every 6 months or if soiled. To change it, all you have to do is untwist it, throw it out, grab a new one, and twist it back in. It does protect your turbine, which is very powerful. On non-invasive, it can achieve peak flows up to 230 liters per minute and has a very powerful leak compensation. Next section is your O2 source. Your primary source is your 50 psi source. The benefit is that there is no limitation no matter what your patient volume or minute volume is. You do have the low flow source that you can use, which is really a backup to your primary source. If you do use the low flow source, you will need to hook it to a flow meter and adjust the flow in order to achieve the volume, the FI2 that you set here. Next is your external battery. Your external battery is 2.5 hours. And the device is equipped with another 2.5 hours battery internal. So together it makes 5 hours. When it charges the battery, it will charge your internal battery first, and it will charge your external battery next. When it uses the battery, it will use your external battery first, and then your internal battery. Next is the main screen of your device. As you see here, you have 3 LED indicators. The blue one means that we are connected to a AC power outlet. And then you have the status of our internal and external battery. If you see a steady yellow light, that means that your battery is fully charged. If you see a flashing yellow light, that means that your battery is charging, which is where I would like to emphasize that when your device is on standby, it should be plugged in to fully charge your batteries. You have a pressure touchscreen of 8.4 inches. Pressure touchscreen means that no matter if you have gloves on or using the transport bag, your touchscreen will still work. Next, you have your visual alarm aid. If you see a high priority alarm, it will be a red flashing. A medium priority alarm will be a yellow flashing, and a low priority, a steady yellow. To use the device, every change that you do has to be in 3 steps. You select a parameter, you'll have to adjust it with the knob, and then always confirm. That is a safety feature with the monnal t60. On top of the device, you have 3 ports. You have 2 USB ports that you can download all of the history, trends, and black box onto the USB, as well as the configuration, and a RS-232. The next section that we'll be talking about is the patient section. So the first port is your inspiratory port. It is suggested to always have a filter to protect any contamination to the device. When it comes to the monnal t60, there is no proprietary filter or circuits to use as long as it respects the resistance specification. The next button that you'll see here, the white button, is to eject your expiratory assembly. By clicking on it, it will release it. It is composed of 2 parts. You have your expiratory valve and your flow sensor. It is when you see a clear one, that means that it is single-use patient. If you do see a purple one like so, this is reusable up to 50 cycles. When putting them together, you will have to make sure that they are aligned. One trick is one is facing up, one is facing down, and you make sure that when you enter, it is a tight fit. When you use the reusable assembly, the mushroom valve here must get thrown out after each use. When putting in a new one, you do have to make sure that it is entered properly. To put it back in, you insert it one way, and you'll hear a click. Once you hear your click, you know that the assembly was inserted correctly. You can actually have the option of just removing the flow sensor by pressing on the little lip of the flow sensor. When you do so, you will lose your expiratory monitoring, and you can go grab a new one. To do so, all you have to do is place it through the opening on the bottom and push it all the way in. There is no flow sensor test to do because it really recalibrates itself every 2 minutes. Like I said, there is no proprietary circuits for the device as long as it's dual limb. The next option that we're going to talk about is the CO2 cable. As you see here, there is a port for your CO2. Once you insert it, you will have a green flashing light which warms up the CO2 probe right away. These adapters are single patient use. You have the choice of a ped adult one or a neo, and there's only one way to insert it. Please note that this CO2 probe is actually an Irma Massimo CO2 software. This training on the monnal is based on the 2.7.2 software. If your device has a different software, it is possible that you will notice some minor changes. On the screen, we will start our training on the left side and work our way down. The first button here, we will come to it later while we're ventilating. Next is the status of the battery. When it's fully charged, it's fully green. When it's charging, you will notice that it's blue flashing. Next is your button of silence for 2 minutes. If you do have any alarms that come up, it will be listed here with a drop-down menu. Next, it's your day and night, and then to lock the screen. Once you click on the lock screen, you cannot do anything. To unlock, you press the button, and you always have to confirm with the knob. Going down is your auto test. The auto test is 2 or 3 minutes. When you do the auto test, it is recommended to perform it before each patient use or when you change consumables. We suggest when you perform the auto test, your circuit is set up how it will be used on the patient, meaning if you have a filter on your inspiratory and expiratory with a HME at the end. For the auto test, you just click on the button. It tells you the steps right here, how to set it up. Make sure it is blocked, and you can use the actual plug on the roll stand, and you click validate. During this time, it is doing the compliance and resistance of the circuit, a leak test, and calibrating your flow sensor as well. At the same time, it will also do a mixture check if you are connected to a 50 psi source. If you are not, when it reaches the mixture check, it will give you a little eye and say that this test was not performed. At the end, it will still be successful. It's going to ask you to unblock the circuit. And it's at this point where it will actually wait for you to come back if you got called away, so you don't have to restart the test. it will tell you the test is successful and give you the results of the circuit compliance. When it is completed, you click on Finish, and you will notice on the main screen, it will have the previous test date and time. We'll continue with the buttons here on this side. The next one is Trends. You have up to 80 hours of trends, and you can also look through different trends, whether it's minute volume, CO2, peak pressures, and so on. In order to look through the different graphs, you hold on the graphs and it opens a little side menu here. To return to the main screen, you click on Back and click back on Trends to come back to the main menu. You can rotate the screen 180 degrees just by clicking and confirming. It rotates it. To go back, again, 180 degrees, and you confirm. Next, the button we'll click on is Menu. So here you'll have different options. If we start by sensors, this is where you could actually do a CO2 calibration if the device asks you to do one. It will take about 3 seconds. You click on it, you confirm, and you'll see the light flashing for 3 seconds. When the light stops flashing, that means you're ready to go and you could put it in use, like so. The next option you have is your FiO2 measurement. If you feel your O2 cell is not accurate, you can deactivate it and insert in an external analyzer. Your next one is your flow sensor, which is your expiratory flow measurement. If you feel that you need to change your flow sensor, when you remove it, like I showed you before, it'll give you an alarm. You can stop that alarm by deactivating your flow sensor here. Go grab a new one, insert it, and reactivate it. Remember, there is no flow sensor test to do because when it's in use, it's recalibrating every 2 minutes. To come out, you press back. The next menu we'll go is patient monitoring. This is where you'll have your report for your history and trends, and you can download this onto a USB by inserting your USB here and clicking on Transfer. Next, configuration. This is where you can configure your device with the volume, the brightness of your device, alarm flash, which is here, so meaning that you can deactivate it, and alarm inhibition. Alarm inhibition means that it's a pre-silence of your alarms before you disconnect your patient circuit for 2 minutes, unless it's a high peak pressure or a technical alarm that comes up. In order to alarm inhibition, you have to hold down the alarm silence for 3 seconds, and you will have it written over here under your alarm menu. Next is keypad tone. If you do activate your keypad tone, that means every time you touch your screen, it'll go beep, beep, beep. And the next is your date and time. So the next is your low pressure O2. As mentioned before, you do have a low flow O2 source here on the side. If you would like to use it, you should activate it here to prevent any alarms coming up. On the main screen, you will see the option of ventilation modes. By clicking on it, you'll see all the modes that are available to you. You will see that you have the option to do invasive or non-invasive. The difference between invasive and non-invasive is on non-invasive, the turbine will work a lot faster to compensate for leaks, and you can achieve peak flows up to 230 liters per minute. The only mode that is not available on invasive is CPAP. And you'll see that by clicking on CPAP, it will turn non-invasive, it will highlight non-invasive right away. On the main screen, you will see that there is a mode called emergency ventilation, which is a volume-based mode that will calculate a volume between 6 to 8 cc's per kilo according to your patient height and weight. As soon as you click on it, it will start ventilating your patient with preset parameters that, like I said too, that are volume-based. These parameters can still be adjusted. Again, as I mentioned before, as you select, you adjust, and you have to confirm with the knob. One thing that's really nice about the monnal is that when you want to change a parameter, there's this little yellow useful toolbox that shows you the changes that you are doing. So example, by changing your respiratory rate, it's going to elongate your TE, and that's shown right here. When you see arrows like this on the side, that means that there is a second page for you to navigate through. For your trigger, it is a flow trigger. The higher the number, the harder it is for the patient. Now, one thing to remember is that there is an algorithm in the background of a pressure trigger that you cannot set. It is corresponding to the flow trigger that you are setting. So whichever is easier for the patient, that's the one that's going to initiate the breath. In the volume mode, you can change the flow curve to decelerating or constant. You can also set a plateau pressure. A plateau pressure of 0.3 seconds is efficient to give you an accurate reading of a plateau. You also have the option of adding volume sigh breaths. When you click on a sigh breath, you can adjust it. If you click 1.5, that means your sigh breath will be 1.5 times higher than the volume that you set. This here is considered your clinical screen, and it's divided into two parts. You have your curves on one side and your monitored parameters on the other. Your monitored parameters are 12 and over 2 pages. There is no other alarm page to go to. Each square has its own high and low threshold. To adjust your threshold, you click on either the higher or lower, like so, adjust, and confirm. For your graphs here, you can actually change your graphs by holding onto it. It will open up a menu on the side. If you did by the option of the flow volume loop, it will be displayed here. Once you click on the flow volume, you will see your curve here. You can actually freeze your curve by clicking on freeze, like so. Once it is frozen, you can use your cursor and look at your values that are written up here. To come out of the loops, you click back, like that, and then exit. To enter your monitoring screen, you do so by clicking the left corner. It increases your graphs and puts your 12 parameters over 3 pages. It's on this page here where you're able to freeze your screen. In order to do your pauses, you must click on your inspiratory pause, hold your finger, and it will say inspiratory pause in progress. Same for your expiratory pause. You have to keep your finger on the option of expiratory pause, and it will say expiratory pause in progress. Once you let go, you'll get your value for your auto peep under your peep total here. To come out of this screen, all you have to do is click on the left corner and it brings you to your clinical screen again. To switch to your ventilation modes, you don't have to go back to your main screen. You could actually click on the mode that is active for you on the bottom right of the corner. When you do so, it opens up your ventilation mode screen here. Again, when you see arrows, it's because there's a second page that you can navigate through. And we'll actually go on PRVC. When you click on mode, all of the parameters that are available to you are listed on the bottom. Again, when you see an arrow, it's because there's a second page. To enter the mode, you do have to validate, and it will turn into the mode. As you see here, you have your target volume, respiratory rate, and PEEP. We will go on to the second page. You'll notice that your PI pressure is actually set in auto. As you know, PRVC works with an auto-regulate pressure to achieve the target volume. You can actually directly set a pressure if you need to take control quickly. If you do so, you will notice that your target volume is actually set to off. We will set a volume to return into a target volume. The next parameter is your PI max, which is your pressure limitation. Your delivered pressure cannot exceed the pressure limitation. You will notice that this alarm came up, incompatibility between target volume and settled pressure. This means that your target volume and your pressure limitation is not set properly. To clear it, either you adjust your pressure limitation or you adjust your target volume. To shut down the device, as a safety feature, you cannot turn it off by the side. You will need to put the device on standby by clicking the pause button right here in the corner, and of course confirming, which is a safety feature. Once you're on the standby screen, can be done by either clicking the green button and confirming, or by clicking shutdown right here and confirming. Something that's really nice about the monnal t60 is that you can configure it to how you would like. That means you can actually configure the standby screen, you can preset default parameters, as well as alarm thresholds. Another feature that we did not speak about is the oxygen therapy, which is actually your high flow therapy. In order to use high flow therapy, it will be the same circuit that you guys use, which is the single limb facial. You will hook it onto your inspiratory port, hook a humidifier here, and the inspiratory limb connected to the OptiFlow. Depending on the category that you choose, the flow that you can achieve is different. On the adult mode, you can actually achieve up to 80 liters per minute. We're going to enter the mode by clicking on it. When you do, you can directly set your FiO2 and then your flow. Your high peak pressure that's listed here becomes your peak pressure that you can set. I would like to thank you for your attention during the monnal t60 in-service. If there are any questions that do come up, please do not hesitate to ask one of your clinical specialist team members. It will be a pleasure to assist you. Thank you very much.